Hello everyone, I'm Dr. Piao. Today we will be discussing Bell's palsy, its causes, affected channels, and how we approach treatment with acupuncture in traditional Chinese medicine. Bell's palsy is a condition that causes sudden weakness in the muscle on one side of the face. Often, this weakness is temporary and improves over several weeks. The affected half of the face appears to droop. Smiles become one-sided, and the eye on the affected side may be difficult to close. Now, take a look at this picture. Notice the difference between the left and right sides of the patient's face. The right side shows clear signs of weakness. The patient cannot wrinkle the brow, cannot close the eye fully, the eyelid droops, the nasolabial fold is flattened, and the mouth corner sags downward, producing an asymmetrical smile. In traditional Chinese medicine, we call this condition 面瘫, which literally means facial paralysis. Another related term is 口癖, which translates as mouth deviation. Both terms refer to what Western medicine calls Bell's palsy, a sudden paralysis of the facial muscles. In TCM, Bell's palsy is classified as deviation of the mouth corner or sudden facial paralysis. The hallmark feature is the sudden inability to move the facial muscles on one side, often accompanied by difficulty closing the eye, slurred speech, and distortion of facial expression. But more importantly, we look beyond the symptom. We ask why it happens. And in TCM, we find the answer in the relationship between qi, blood, and wind. Wind is the primary pathogenic factor. It's sudden, fast-moving, and unpredictable, just like the sudden onset of this disease. Because the face is located in the upper part of the body and traversed by several yang meridians, it becomes the first target of an external wind invasion. That's why we often say when wind attacks, it first reaches the head and face. Let's look more closely at the mechanism. Bell's palsy occurs when wind, sometimes mixed with cold or heat, invades the facial region, blocking the normal flow of qi and blood. If the person's healthy qi is weak, perhaps from stress, overwork, or lack of rest, the body cannot defend itself. The wind lodges in the meridians, qi and blood become stagnant, and the sinews lose nourishment. The result? The muscles of one side of the face become flaccid and unresponsive. Meridians involved are the Yangming and Shaoyang channels. These pass through the frontal, lateral, and buccal regions, exactly where the paralysis occurs. So this disorder is both external, caused by wind invasion, and internal, linked to weakness of qi and blood. In simple terms, the flow of qi is like a gentle current of water feeding every branch of the face. When wind obstructs that flow, the water stops moving, the muscles lose power, and the expression disappears. Our task as practitioners is to restore the movement, clear the obstruction, and bring the current of the life back to the surface. The treatment principle can be summarized in 3 key actions: unblock the meridians, regulate the sinews, and expel pathogenic wind. When qi and blood circulate freely again, the sinews are nourished, and facial movement gradually returns. That is the essence of treating Bell's palsy in Chinese medicine. Now let's talk about the acupuncture treatment. In this condition, we always combine local points on the face with distal points on the hand and foot Yangming meridians. Why? Because Yangming channels are rich in qi and blood, and they run directly through the facial region. So when we work on these meridians, we help restore both local and overall balance. The main points include gallbladder 14 Yangbai, small intestine 18 全疗, stomach 4 地仓, stomach 6 夹车, 三焦 17 一风, and large intestine 4 合谷. Let's go through them slowly. Large intestine 4 合谷 is one of the 4 command points. It governs the face and mouth. That means any disorder of the face, whether pain, paralysis, or swelling, will respond beautifully to large intestine 4. It's one of our most powerful points to dispel wind, open the meridians, and regulate qi circulation through the entire facial region. Now the local points, GB14, stomach 4, stomach 6, and small intestine 18, these are right on the face, along the trajectories of Yangming and Shaoyang meridians. They directly act on the muscles and sinews of the face. When we needle them, we are not only working locally, we are stimulating the qi pathways that nourish and control expression, movement, and tone. You'll notice that as qi and blood begin to flow smoothly again, symmetry starts to return. 三焦 17, 一风, is also essential. It dispels external wind, benefits the ear, and helps restore the natural communication between the facial nerve and the muscles. So, together, these points form a powerful core prescription for Bell's palsy. Needling technique. Now, this part is very important. For stomach 4, 地仓, and stomach 6, 夹车, we use transverse subcutaneous needling. Inserting the needle from stomach 4 toward stomach 6. This method is called penetrating or point-to-point needling. Why do we do that? Because it follows the course of the facial sinew, what we call the Jing pathway, right under the skin. By inserting the needle along this pathway, we are literally guiding qi to reconnect the two ends of the muscle, like rewiring a circuit. This technique is especially effective for reactivating sinew function and helping the patient regain movement. Use a slightly longer needle for this technique and insert it gently, keeping it just beneath the skin. It should feel comfortable for the patient. The goal is to stimulate, not to puncture deeply. Next, let's differentiate patterns, because the external cause makes a big difference in point selection. First, wind-cold pattern. If the onset occurs after exposure to cold wind, say, the patient woke up after sleeping near an open window, that's wind-cold invasion. In that case, we add GB20, 风池, and long 7, 裂缺. GB20 clears and expels external wind from the head and neck. Long 7 opens the exterior and releases the surface. Together, they help drive out wind cold and reopen the facial meridians. Second, wind heat pattern. If the patient had a mild fever or sore throat before the onset, that suggests wind heat. Here, we add 三角 5, 外观, and large intestine 11, 曲池. 三角 5 releases the exterior and clears heat from the Shaoyang meridian, and large intestine 11 clears heat and wind from the Yangming meridian. These two together effectively reduce inflammation and help qi circulate freely again. Qi and blood deficiency. In chronic or recurrent cases, you may find underlying qi and blood deficiency. These patients often recover more slowly. In such cases, add stomach 36 Zhusanli and Ren 6 Qihai to tonify qi and blood, strengthen the body, and support full recovery. Now, let's fine-tune according to the specific symptoms. If the mental libido groove is deviated, add Ren 24. This helps correct the mouth asymmetry and restore natural muscle tone. If there's slurred speech or tongue stiffness, add Ren 23, Lian Quan, to promote tongue movement and open the channels around the throat. For difficulty closing the eyes, add Bladder 2, Chuanzhu, and Bladder 60, Kunlun, to strengthen eyelid control and support the orbicularis oculi muscle. If there's tearing or excessive lacrimation, use Stomach 1, Cheng Qi. Its name means receiving tears. It regulates the eye area and helps normalize tear secretion. Finally, if the patient complains of hyperacusis, that's an unusual sensitivity to sound. Small intestine 19, Tingong, and Sanjiao 3, Zhongzhu. Remember, in Bell's palsy, the facial nerve passes close to the auditory canal, so sound sensitivity can occur. These 2 points regulate qi in the ear region and calm internal wind. Patients will often report that ordinary sounds, which felt sharp and uncomfortable, begin to feel normal again after treatment. When you treat Bell's palsy, always think dynamically. External wind, meridian qi, and sinew connection. Our job is to restore that smooth flow. The key is to move qi, nourish blood, and guide the sinews to recover their normal tone. Once the obstruction is gone, the facial expression, the person's natural vitality returns. Let's review the key ideas. Location, the face. Meridians involved, Shaoyang and Yangming. Pathogenesis, obstruction of qi and blood due to wind vision and sinew dysfunction. Treatment principles: unblock meridians, regulate sinews, expel wind, and restore qi flow. Key technique: penetrating needling from stomach 4 toward stomach 6 to reconnect sinew pathways. Thank you for your attention. If you have any questions, please email me or post them in the course discussion forum.